Hello, everyone. I'm Dr. Lola Ashaye, and you're listening to Connecting the Dots with Dr. Ashaye. So in the last episode, I discussed 3 ways to naturally reduce blood pressure. And I hope that if you have high blood pressure, you chose at least one method and you're tracking it and you're proving to yourself that it works for you. Today, I want to discuss other evidence-based practices that have also been shown to lower blood pressure naturally. And as we have discussed, we know that high blood pressure can cause a lot of problems, and that lowering blood pressure is very important. So if you are maybe you're already lowering your sodium intake, maybe you're engaging in regular physical activity already, you're avoiding substances that can raise your blood pressure, but you want to do more, or you just want additional tips you can combine, then this episode is for you. Again, this is Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, Texas. And here we help you become and remain healthy so you can live fully and enjoy doing what you love. Okay, so we know that our blood pressures are elevated, that when our blood pressures are elevated, our vessels are constricted. That means they're made smaller. Or it can be that, when the heart is no longer working properly, our blood pressures can get elevated, or when we have excess fluid in our bodies. And most blood pressure medications, basically, they work by relaxing the vessels or getting rid of excess fluids, or they can help the heart work better. But the good news is our bodies also have the ability to do these things under the right environment. And so what kind of things can we do naturally to help our bodies, engage in this type of activities to lower our blood pressure? Well, the first thing I'm going to talk about is healthy eating. And in addition to low sodium diet, there are actually specific foods that are associated with lowering blood pressure. And those are foods that are rich in potassium, for instance. So foods that are rich in potassium, like dark leafy green vegetables, have a lot of potassium. Berries have a lot of potassium. Legumes have a lot of potassium. So it's been shown that getting 3,500 to 5,000 milligrams of potassium with food, dietary potassium, can lower blood pressure by about 4 points. So of course, you want to make sure that it's safe for you to eat a lot of potassium based on your medical condition. So whatever you do, always check with your doctor. And of course, we know fruits and vegetables, always a good idea, right? So fruits and vegetables, whole foods are very helpful as well and have been shown to be associated with the lower blood pressure. Other things like eating foods that are high in fiber, that are rich in fiber, and also foods that are rich in omega-3 fatty acids have also been shown to lower. So that's like cold fatty fish, for instance, have been shown to be associated with lower blood pressure. And then there are specific things like flaxseed, hibiscus tea, which in some parts of the world known as zobo, fresh garlic, celery, decaffeinated green tea. Also, these specific foods have been associated with lower blood pressure. So there are ways we can, like for people that have high blood pressure, you can try to get more, healthy fruits and vegetables, increase your omega-3 fatty acid intake, increase and start eating some of these specific foods if it's safe once you've discussed with your primary care doctor. And then, you can watch and see what happens with your blood pressure. But healthy eating is a powerful way to lower blood pressure. And that's including, obviously, lowering your sodium intake. So that's the first thing I wanted to share about something you can do naturally to lower your blood pressure today. Okay, so before I talk about the next two, if you want to help spread the word and share these valuable resources with others, there are 3 easy ways you can do it. You can subscribe, you can share this video, you can like it. By doing these things, you help others improve their health. You help us reach a wider audience because you're telling them, check out this video. So if you have not already, please take a moment to subscribe, share, and like our video. And it's a small action. It can make a big difference for, people that are dealing with different health conditions. Okay. So the next thing I want to talk about is something that I hope, we would take seriously. It's one of those things that we tend to blow off a lot. And you've heard me talk about this many times, and that's because it's really important, and that is sleep. So sleep is so powerful, and sleep is very helpful for us to maintain good health, and sleep affects our blood pressure. So we know that during a phase of sleep called non-REM or non-rapid eye movement sleep, our heart rate and our blood pressure tends to go down. And then during another phase of sleep called the REM sleep or rapid eye movement sleep, our heart rate and blood pressure can become very variable. But we also know that our overall quality of sleep, when we have good quality sleep, we have what we call nocturnal dipping, which means our blood pressure dips lower. And we know that that's good, that's healthy for us, that's healthy for our heart. And we know that when we do get good sleep, especially when we get a long duration of sleep, the appropriate duration of sleep, we have better blood flow to our extremities, our core body temperature improves, and our stamina is better. So we know that sleep is very important for our heart and very important for our blood, which is, important for our blood pressure. So we also know that people that do not get good quality of sleep, for instance, people that have sleep apnea, they tend to have increased heart rate and increased heart rate variability, and they don't get that normal deepen of their blood pressure, okay? They also tend to have a higher average blood pressure compared with those that don't have sleep apnea. But even people without sleep apnea, people that don't get enough sleep or don't get a long enough sleep, we know that their blood pressure at night tends to be higher, and they also don't get good blood flow to their extremities. Their core body temperature is higher, and they get their CRP, which is an inflammatory marker, C-reactive protein, is higher, and C-reactive protein has been associated with heart conditions. So I share all this to say that sleep definitely affects our blood pressure, and that's with the sleep quality, the quality of sleep we're getting, and also the quantity of sleep we're getting that 7 to 9 hours of sleep. And getting adequate sleep, that's a free way, a cheap way to be able to keep our blood pressure at a healthy level, and also keep our heart healthy. And sleep has so many benefits. I mean, we've talked about it so many times on this channel. So prioritizing sleep is just, very important for our overall health. And it can really make a difference very quickly. So that would be the second thing that I'll highly recommend. If you have high blood pressure, or even when you don't, you should just try to get good quality sleep and a good duration of sleep. Okay. Now, the last thing I'm going to share today in terms of lowering blood pressure naturally is stress reduction. So I know pretty much most people know that stress raises blood pressure. Some of us can't even feel it happening. We notice heart rate is racing, we feel flushed, we may have a headache, we just notice body changes when we're stressed, and our blood pressure is supposed to increase because our body is trying to help us act quickly. The problem, though, is that this stress reaction can become a problem if it's happening too often or if it's constant, right? If your body doesn't get a break, because our bodies are not built to stay in this stressed state for prolonged periods or to have it happening all the time. It puts too much stress on our organs when that happens. Well, the good news is even though we cannot always control that stress reaction, like if you're caught by surprise, there are things that we can do to quickly counteract it. There are things we can do to relax And we can do them very quickly. And for example, you know, we've heard about taking big, deep breaths. That actually lowers our heart rate and lowers our blood pressure. And that helps with keeping our organs healthy. But that's just in the, you know, short term. For long-term lowering blood pressure, it actually requires more daily practices, something that you do daily to reduce stress. And we know that stress will always happen as long as we live in this world. There will be things that will cause stress. So having a daily practice helps us build resilience, helps us improve our response so that we can keep our blood pressure and maintain a lower blood pressure. So there are evidence-based relaxation methods, things like meditation, physical activity, team sports, for instance, prayer, yoga, tai chi. There are different things and many different things that we can engage in, but the key is doing these things consistently, regularly, making it a daily practice to lower our stress threshold and also to build resilience so that we respond better to stressful stimuli. So it's important to, you know, do our best to try to make sure we're doing something to make sure that we're putting our body in a good position and relaxed position so that we can handle stressful situations better. And that, again, lowers our blood pressure. Okay. So if you are in the Houston area and you have high blood pressure or other conditions that, you know, you want to be treated and you're looking for a doctor that is proactive about your health, well, we're here for you at InTouch Primary Care. You can learn more about our services and how we can help you at our website, intouchprimarycare.com, or you can call us at 713-280-9985. And we look forward to hearing from you and helping you on your journey to a better health. So imagine that you started to prioritize your sleep, or you're more intentional about consistent relaxation practices, or you just, you know, decide that you're going to focus on eating healthier. Not only would you lower your blood pressure, you will actually feel a lot better, and you'll be preserving your organs, you'll be reducing your risk of heart, brain, kidney, eye, and many other, you know, serious conditions down the road. And you can look forward to having a good quality of life and enjoying your loved ones. So it's certainly very worth it to engage in these practices for your blood pressure and for overall health. I hope that helps.